Alright student, welcome back to BSc Nursing. Today's session is all about practicing NCLEX based questions together, and I will show you exactly how to think, how to approach and how to eliminate options the right way. So get ready because today all your confusion ends here. I took some NCLEX questions because students might be thinking like NCLEX is very high conceptual book, but no, it's not like that. If you understand the concept, no matter examiner take questions from which book, it will be easy for you to answer any kind of questions taken from any book. So let's begin this today's session. So our first question is, a client is at 7 weeks of gestational presence with unilateral lower abdominal pain, okay, and light vaginal bleeding. The nurse suspect an ectopic pregnancy. Which additional finding best supports this diagnosis? Okay, so your options are enlarged and painless uterus, option B shoulder tip pain, option C severe nausea and vomiting, option D fetal heart tone heard on Doppler. So now see how I eliminate other options and take the right answers. Okay, so here the question is, client is 7 weeks of gestation with ectopic pregnancy. So which best supports this diagnosis? Okay, which one is supporting the diagnosis of ectopic pregnancy? That is your questions. So the options enlarged and painless uterus, I won't choose this answer of painless uterus, okay, because this ectopic pregnancy's feature is the triad of ectopic pregnancy. If I say, then your triad will be amenorrhea, absence of menstruations, okay, amenorrhea, then vaginal bleeding, and the third one is pain in abdomen. So if a mother is carrying the ectopic pregnancy, then mother must be facing pain in abdomen, as it is said painless uterus, so it won't be the answer. Now option is severe nausea and vomiting. Severe nausea and vomiting means it is the feature of hyperemesis gravidarum. Okay, so hyperemesis gravidarum is the feature of molar pregnancy that we will come later, but it's not the feature of ectopic pregnancy, so it is also not the best indications of ectopic pregnancy. That's why I won't choose option C. Now option D, fetal heart tone hard on Doppler. So fetal heart tone hard on Doppler, this is the feature of normal uterine pregnancy. If you hear the fetal heart tone by doing the Doppler study, then it is good sign of having normal intrauterine pregnancy. If it is ectopic pregnancy, then you can't hear this fetal heart tone in Doppler. So normal uterine pregnancy feature of getting the fetal heart tone on Doppler. So that's why D also not the answer. So what is the correct answer? Shoulder tip pain. Why shoulder tip pain is the correct answer? Because this is the feature of ruptured ectopic pregnancy. Why? Because when mother will be having ruptured ectopic pregnancy, then blood will accumulate in peritoneum. As a result, hemoperitoneum will be seen. Okay, now due to this hemoperitoneum, referred pain will be occur where? In shoulder region. This is referred pain. That is the feature of ruptured ectopic pregnancy, and it is an emergency situation. So this is the correct indications of having ruptured ectopic pregnancy. So what will be the correct answer? Correct answer will be shoulder tip pain. Now let's move to the next questions. What is our next question? The nurse is caring for a client diagnosed with unruptured ectopic pregnancy. Okay, so which laboratory values must be monitored before administering methotrexate? Now remember, methotrexate will works by checking the beta HCG value. If the beta HCG value is less than 5000 milli international unit per ml, then only we will use methotrexate. So whenever we are administering methotrexate, we need to monitor this beta HCG value. Hemoglobin is not a deciding factor. Okay. Creatinine is also not the primary criteria, and platelet also not a relevant factor. When I took the class, that time I told you, if the beta HCG value less than 200, we won't do anything. We will take the management, expected management means what? Means just simply wait and watch. You don't need to do anything. If the beta HCG value less than 5000, then we will use medical management. If we use methotrexate here, it will works nicely and pregnancy will be end up by using this methotrexate. If the beta HCG value more than 5000, then methotrexate won't works, because it will works only when this value is less than 5000. So when it is beyond 5000, then we will use surgical management. So whenever we are administering methotrexate, we need to monitor this beta HCG level. Okay, now the next questions. So which is priority nursing action for a patient with suspected ruptured ectopic pregnancy? Okay, now this is the examiner has mentioned that this is a suspected ruptured ectopic pregnancy. Means healthcare workers are suspecting that it is already a ruptured ectopic pregnancy. So I told you during taking the theory classes, ectopic pregnancy can be of two types, either ruptured or unruptured. So ruptured means mother is hemodynamically unstable, but here mother is somehow stable in unruptured cases. Okay, so whenever it is a ruptured case, or that means mother is hemodynamically unstable and it is an emergency situation, so we need to do surgery, that to emergency surgery, that is laparotomy or laparoscopy, depending on mother's hemodynamic stability. So the management of ruptured ectopic pregnancy is what? Prepare the mother for emergency situations, because this is a life-threatening situations. Now in such cases we need to save the mother's life. Now here we need to prevent the bleeding from where it is occurring. So for that, prepare the mother for emergency situation. Start oxytocin infusion is not the correct answer, because we will never use oxytocin during ruptured ectopic pregnancy. Never use. Now, if you insert Foley's catheter, if you begin oral hydrations, okay, this is a life-threatening conditions. Mother might go into shock, okay, severe hypotension, tachycardia. All this is a life-threatening indications. So in that cases, if you insert the Foley's catheter, if you begin oral rehydration therapy, that delays the life-saving treatment. So if you save the mother's life, prepare for emergency surgery, that is laparotomy or laparoscopy. So what will be your correct answer? Correct answer will be prepare the mother for emergency surgery. Move to the next questions. What is our next questions? Okay, which clinical finding differentiate between ruptured ectopic pregnancy and unruptured ectopic pregnancy? Now, which one is clarifying you or telling you that this is the clear differentiations between ruptured ectopic pregnancy and unruptured ectopic pregnancy? Now, listen carefully how I am eliminating the others options and taking the correct option. Your first option is missed period. Now, if mother is having missed period, will you differentiate between ruptured ectopic pregnancy or unruptured ectopic pregnancy? No. If a mother carrying normal pregnancy, okay, if a mother carrying ruptured ectopic pregnancy, if a mother carrying unruptured ectopic pregnancy, okay, in all situations mother will be having missed period. So how will you differentiate this missed period? By checking the missed period, you will differentiate ruptured ectopic pregnancy and unruptured ectopic pregnancy. That's why it won't be the answer. Okay, option A is not the correct answer. Now, positive pregnancy test, it is also not specific, because if a mother carrying ruptured ectopic pregnancy, that time also mother is pregnant. If mother is carrying unruptured ectopic pregnancy, that is also one kind of pregnancy situations. If a mother carrying normal pregnancy, that time also it will give you positive pregnancy test. So it is also not specific in such cases. Now, unilateral pelvic pain. In unilateral pelvic pain seen in both conditions. Both condition means what? Both condition means both unruptured as well as ruptured. Because in both situations, the situations is ectopic pregnancy. That means unilateral situations, unilateral pelvic pain will be seen in both cases. So it is also not the features of having unruptured or ruptured ectopic pregnancy. Means you can't differentiate by looking into this unilateral pelvic pain. If mother is complaining, I'm having unilateral pelvic pain, that can be happening both in unruptured ectopic pregnancy and ruptured pregnancy as well. So how to differentiate this? So by checking sudden severe abdominal pain with dizziness. Now, why this C is the answer? Because sudden severe abdominal pain with dizziness. This is the feature that mother is undergoing shock. Dizziness indicating mother is undergoing, or mother's BP is getting decreases. That means hypotension. Severe abdominal pain indicating severe hemorrhage. Okay, and all those features seen in ruptured ectopic pregnancy. Ectopic pregnancy. If mother is having unruptured ectopic pregnancy, that means mother is hemodynamically stable because there is no bleeding. So there won't be any dizziness. Okay. If mother is having unruptured ectopic pregnancy, mother will be having mild pain. So if mother is having severe abdominal pain, mother is complaining of sudden severe abdominal pain with dizziness, then this is the feature of ruptured ectopic pregnancy, not unruptured ectopic pregnancy. So that's why question number 4's answer will be sudden severe abdominal pain with dizziness. So option C will be the correct answer. Now move to the next questions. Which of the following is contraindication for methotrexate therapy in ectopic pregnancy? Okay. Now which one will be the contraindication for methotrexate therapy? So let's see how I'm eliminating the other options and taking the correct option. Now methotrexate therapy means if there is a ruptured ectopic pregnancy and if there is a case of unruptured ectopic pregnancy. I told you earlier ectopic pregnancy can be of these two types. So ruptured ectopic pregnancy, always and always you will do emergency surgery. There is no other options. Either you will go for laparotomy by giving large incision, or you will go for laparoscopy. Anything you can do. So always and always ruptured ectopic pregnancies management will be emergency surgery, as because it is a life-threatening situations. Now if it is a case of unruptured ectopic pregnancy, you can go for expectant management. You can go for medical management. Medical management means you will give methotrexate as it is mentioning here, or you will go for surgery depending on the mother's situations. But this unruptured ectopic pregnancies management always and always you will do when mother is hemodynamically stable. Okay, remember, hemodynamically stable. You will never do when mother is hemodynamically unstable. When mother is hemodynamically unstable, that means mother is having ruptured ectopic pregnancy. In that situations, mother is hemodynamically unstable. In that situations, you will never use methotrexate therapy, you will never use expectant management, you will never use surgical management. Okay, expectant surgical management. So that's why what is the contraindications of methotrexate therapy? See here in option C, it is saying hemodynamically instability. If mother is hemodynamically instable, not stable, then why will you go for this medical management? Because methotrexate you will use when mother is hemodynamically stable, but if mother is hemodynamically unstable, you can't use this methotrexate. You will always do surgery. That's why contraindications of methotrexate therapy is when mother is hemodynamically unstable or instable. Okay. Now, if beta HCG value less than 5000, this is obviously good for methotrexate, right? Good for methotrexate. If there is no fetal activity, you just use methotrexate. That also good for methotrexate therapy. Now, if the ectopic mass is less than 3.5 centimeter, that is also good for methotrexate. Now if the ectopic mass is less than 3 centimeter, you will go for expectant management. If the mass is less than 3.5 to 4 centimeter, you will go for medical management. That's why this is not the contraindications. And if the mass is more than 6 centimeter, you will go for surgical management. That also when mother is hemodynamically stable and mother wish that she doesn't want future baby anymore, she does not want fertility preservation, so then you can go for surgery after taking mother's consent. Okay, but if mother is hemodynamically unstable, go for emergency surgery. So what is the contraindication of methotrexate therapy? When mother is not stable hemodynamically. Okay, that's why option C is the correct answer for question 5. Now let's move to the next questions. What is our next questions? Which of the following assessment finding requires immediate interventions? Immediate intervention means somehow it sounds like emergency situations. You need to manage these situations immediately. So what is this? Assessment findings requires immediate interventions. So mild cramping. Whether mild cramping needs immediate interventions? No. Mild cramping even you can see in normal early pregnancy also. Okay, early pregnancy. That can be seen in normal pregnancy also. That can be seen in unruptured ectopic pregnancy, unruptured early ectopic pregnancy. In case of ruptured ectopic pregnancy in early phase mild cramping, that's why is not the answer. Coming to the positive pregnancy test. Whether positive pregnancy test need immediate intervention? No, it's not specific. Because if it is an unruptured ectopic pregnancy, that also indicates you of having positive pregnancy test. So for that, you don't need immediate interventions. Now, beta HCG value 1500 milli international per ml. Now, this is also not an emergency by itself. Okay, so what is an emergency situations? So the emergency situations is shoulder pain and fainting. Why? Because this is indicating shoulder tip pain is referred pain of ruptured ectopic pregnancy. Ruptured ectopic pregnancy. Now, if due to hemperitoneum means blood accumulates in peritoneal region, and due to that referred pain is occurring where? In shoulder tip region, and fainting due to shock, due to hypotension, and all those are clearly indicating that mother is having ruptured ectopic pregnancy. That's why this assessment finding needs immediate intervention. So the correct answer for question number 6 is option C, that is shoulder tip pain and fainting. Okay, now the next question. So our next question is, the nurse teaches about future fertility after unilateral salpingectomy. So what is salpingectomy? Salpingectomy means removal of affected fallopian tube. Where we use this? We use in case of ruptured ectopic pregnancy. In case of unruptured ectopic pregnancy also we can do if mother wish to give you the consent of undergoing this kind of surgery. Now, unilateral means one side fallopian tube. Okay, removal of affected fallopian tube, and unilateral means one of the fallopian tube you are cutting and removing. Okay, now unilateral salpingectomy. After unilateral salpingectomy, you teaches about future fertility to the mother. Which statement by the patient shows understanding? Which one statement by the patients clarifying you that mother understand this future fertility concept? Okay, now so your option is I cannot get pregnant again. Mother is saying I cannot get pregnant again. Now, do you think if let's think this is a uterus. Okay, this is an uterus, and this is one side fallopian tube, this is another side fallopian tube. Okay, so now you cut this side fallopian tube, unilateral salpingectomy. Okay, now if you done this unilateral salpingectomy, other side fallopian tube is still preserved, mother can still get pregnant, that too normal pregnancy also mother can get in near future. So if you do this unilateral salpingectomy, mother can pregnant again because her another fallopian tube is still preserved. So if mother is saying I cannot get pregnant again, that means mother is not understand the concept. So that's why option A won't be the answer. Now coming to the next options. I will need IVF for future pregnancy. IVF means in vitro fertilizations. Mother is saying I will need IVF, in vitro fertilizations, for future pregnancy. That's indicating you that here also mother did not understand the concept of unilateral salpingectomy, because you did this unilateral salpingectomy of one of the fallopian tube. Other fallopian tube is still in good conditions. Now, if other fallopian tube is in good conditions, then mother can still get pregnant, that too normal pregnancy. So for that, mother doesn't want this IVF. Okay, so this is indicating that if mother is saying I need IVF for future pregnancy after undergoing this unilateral salpingectomy, that indicates you that mother does not understand the concept. That's why option B also won't be the answer. Now, option D, I will not ovulate anymore. Now, ovulations occur from ovary. Okay, if you cut both fallopian tube also, if you cut both fallopian tube, then also mother still ovulate, because you are not cutting the ovary, because you are not cutting ovary. Okay, so if you do unilateral salpingectomy or bilateral salpingectomy, there won't be any impairment in ovulations. So in questions, it is mentioned that mother had unilateral salpingectomy, so there is no problem in ovulations. And if mother is saying, I will not ovulate anymore, that indicates you that mother does not understand the concept of unilateral salpingectomy. That's why this also won't be the answer. Option D won't be the answer. Now, what will be the correct answer? Correct answer will be option C. My other fallopian tube can still allow pregnancy. Why? Because other fallopian tube is still preserved, still in good conditions. That's why option C will be the answer. It indicates that mother understands the concept of unilateral salpingectomy. So, questions 7 answer will be option C. My other fallopian tube can still allow pregnancy. Okay. Now, question number 8. Which client is most at risk for ectopic pregnancy? Okay, so that in question it is saying most at risk for ectopic pregnancy. That means risk factor. They are asking that too. Which one is most indicating the risk for having ectopic pregnancy? Okay. Now, option A, client using combined oral contraceptive. So, if mother is using combined oral contraceptive, any kind of contraceptive, prevent against ectopic, that too not only ectopic pregnancy, any kind of pregnancy, either ectopic pregnancy or normal pregnancy or molar pregnancy, in any kind of pregnancy, it will protect from any kind of pregnancy. So, using combined oral contraceptive is not a risk factor for ectopic pregnancy. That's why option A won't be the answer. Now, coming to the option B, if mother is having history of pelvic inflammatory disease, that I will come later. Option C, what it is saying? Primary gravida with no medical history. Now, this is a good sign. That means this is good for mother. If mother is having no medical history, that means mother is at lower risk of having this ectopic pregnancy. So that's why option C won't be the option. If there is no risk factor, there won't be having ectopic pregnancy. If mother is having no medical history, that means that is good for the mother for her future pregnancy. Okay, that's why option C won't be the answer. Now, client with history of C-sections. This can be a risk factor. Okay, I won't say it is not a risk factor. That can be a risk factor, but not a major risk factor. So, what will be the major risk factor? Major risk factor will be option B, client with history of PID. Now, why this PID can cause a major risk factor? This PID, because once mother suffers from this PID, it causes scarring of fallopian tube. Okay, and due to that, there can be blockage or damage of fallopian tube, which can be a risk factor for ectopic pregnancy. So, if mother is saying having a history of pelvic inflammatory disease, that can be a major risk factor for ectopic pregnancy. That's why option B will be the answer for question 8. Most at risk for ectopic pregnancy if mother is having history of pelvic inflammatory disease. Okay, now our last questions of today's sessions, what it is saying? In the picture, option A shows normal pregnancy. So, here this is option A. This is showing normal pregnancy. Why? Because this fetus is situated in uterus. Fetus is in uterus. Okay. Now, option B. This will be the option B, obviously. So, in option B, the body grows. The fetus body grows outside the uterus. Here, outside the uterus. Okay. Outside uterus. So, what is this conditions? Now, if I elaborate this picture, you can see this is the normal pregnancy. Why this is normal pregnancy? Because fetus grows in uterus. That means what is this conditions? This conditions is normal intrauterine pregnancy as fetus is growing inside uterus. Now, here in option B, picture B, here fetus grows in fallopian tube, that means outside uterus. Outside uterus, if fetus grows, that is the condition called ectopic pregnancy. So that's our answer, ectopic pregnancy. Okay, so if fetus grows outside uterus, what we call it, the condition called ectopic pregnancy. Okay, that's why this question's answer will be option B, ectopic pregnancy. Normal pregnancy is a good thing. In option A it is normal pregnancy, but in option B it not the answer. Why? Because uterus is not fetus is not growing inside uterus. That's why it is not a normal pregnancy. Molar pregnancy also, it is not the situation or conditions of molar pregnancy, because molar pregnancy is a conditions of gestational trophoblastic disease. Here trophoblast cells abnormally proliferated. That is another conditions that we will come later. And miscarriage. Why miscarriage? Miscarriage also won't be the answer, because here fetus is going outside the uterus. Means pregnancy is visible by looking into this B picture. That's why the condition's name of this question is called ectopic pregnancy. As fetus is growing in fallopian tube, means in outside the uterus, the situation is called ectopic pregnancy. When fetus is going outside the uterus, we will call it as ectopic pregnancy, not intrauterine pregnancy. Okay, so that's all about our today's topic of discussions, where we took some NCLEX based questions, because students are thinking NCLEX is a high conceptual book, and that's why many times they are avoiding to solve this kind of book. But see how nicely I explain all those questions with eliminating the wrong answer and taking the right answer. So in ways exam also you have to do the same way to get the correct options, to get the correct answer. So that's all about today's topic of discussions. Hope this class is helpful. Thank you, dear students.